Hello, my name is Brandy Rowling and I'm an Auburn University nurse practitioner student, and my presentation is on allergic rhinitis. What is allergic rhinitis? It is an inflammatory changes of the nasal mucosa due to an allergy. Allergic rhinitis may occur during a certain season or year long. It can occur at any age. The symptoms may not always be caused by allergies. Symptoms can be caused by side effects of drugs, chemical fumes, smoke, acute stress, being pregnant, and overuse of nasal decongestant sprays. What are the symptoms? Nasal congestion, sneezing, tearing, watery, runny nose, itchy eyes, nose, or throat, puffy eyes or allergic shiners, postnasal drip, and stopped up ears. How does allergic rhinitis occur? This condition occurs when allergens, allergy-causing substances, come into contact with the nose and usually also the ears, sinuses, and throat. Molds, dust, pollens, and animal dander are the most common allergens. Some indoor allergens are present year-round, for example, pet dander or dust mites. Others are present only during certain seasons, for example, ragweed in the fall. When the allergens come in contact with the lining of the nose and sinuses, they trigger the cells to release the chemical histamine, which causes the allergy symptoms described above. Key questions. 1. When did the symptoms start? Rationale. If the timing of the symptoms are seasonal or happened around a certain allergen, then the diagnosis of seasonal allergic rhinitis can be made. 2. What are the symptoms? Any fever? Rationale. The specific symptoms can help distinguish between rhinitis, otitis media, strep throat, or the common cold. Fevers are not typically seen with allergic rhinitis. Number 3. Have you taken any medications for your symptoms, and when did you start taking it? Rationale. It is best to start taking allergy medications before pollen and other spring or fall allergens are in the air. Taking medications early can prevent or lessen symptoms. Objective findings. Make sure to assess and inspect the nose, ears, eyes, mouth, and throat. For the nose, it would have a blue-tinged or pale boggy nasal terminus. Clear mucus nasal drip. Children may have a transverse nasal crease from frequent rubbing. Ears can be normal on exam or have fluid behind the eardrum and be pink or red in the canal. Eyes, under eye circles or allergic shiners. Conjunctivae are usually inflamed with watery discharge. Mouth and throat. Posterior pharynx reveals thick mucus with colors ranging from clear, white, yellow, or green. Posterior pharynx may show cobblestone appearance. How is allergic rhinitis diagnosed? The diagnosis of allergic rhinitis is most often made based on the medical history. Allergic problems also run in families. Some individuals with allergic rhinitis also have asthma and/or eczema, but it may take some work to figure out what the patient is allergic to. Allergy tests are most often done and allergy shots are being considered. The healthcare provider will probably suggest treating your symptoms with medication first. If medications do not control the symptoms, allergy testing may be needed. Treatment plan. Eliminate environmental allergens and stay away from triggers. The first-line medication treatment would be the topical nasal sprays, such as Flonase, azetukalne, and cromolyn sodium nasal spray. Use decongestants such as Sudafed as needed, but do not give to infants or young kids. Consider oral histamines as needed. Second-generation antihistamines over the counter are less sedating, such as Zyrtec and Claritin, that can be taken once a day or as needed. But be careful with Benadryl as it can cause sedation. Nasal irrigation to help clear out the congestion, which is like your neti pot. Refer to allergists for immunotherapy or allergy shots, as they are only measure that offers a cure for allergies. Shots would be a good fit for patients whose symptoms are hard to control with other medications, those who have a hard time avoiding certain allergens, and those with year-long symptoms or severe symptoms. Patients must be able to follow the program plan to receive allergy shots. Here are some examples of the medications that we discussed. Patient education. Patients with allergic rhinitis should be taught not only to avoid allergens, but also to observe the onset, duration, and progression of the symptoms so that they can correlate their flare-ups to environmental exposures and thus better guide self-treatment. For dust mite allergies, avoid using ceiling fans, no stuffed animals or pets in bed. Use a HEPA filter for air conditioners, room filters, cleaning and removing all carpets, drapes, curtains, and dust or mop with a damp cloth so dust mites are not spread around the room. Be careful with the use of Benadryl for allergic rhinitis as it causes drowsiness. Consider a second-generation antihistamine as they are less sedating. And here are my references.